Hi, I'm Dr. Kevin Milo, one of the co-hosts of the Physician Empowerment Podcast. At Physician Empowerment, we're dedicated to improving the lives of Canadian physicians personally, professionally, and financially. If you're loving what you're listening to, let us know. We always want to hear your feedback. Connect with us. If you want to go further, we've got outstanding programming both in person and online. So look us up. But regardless, we hope you really enjoy this episode. Hi, everybody. I'm Dr. Kevin Milo with Physician Empowerment, and I am very, very pleased to introduce you to Dr. Megan Melo. Megan is a board-certified family physician and obesity medicine specialist based out of Seattle, Washington. And she has an incredible coaching business focused on group as well as individual sessions called Healthier for Good. And the goal here is to transform the lives of physician clients who are coming through. And I think you've kind of got a focus, if I can describe it as that, Megan, on perfectionism. So why don't you tell us a little bit about your career journey to start with and how you got to this place? And then we'll get into today's topic.
Yeah. So I grew up in a household of two nurses, and from a very young age, was like, I'm going to go be a doctor, right? And when you grow up that way, you get a lot of positive reinforcement. Oh, a doctor is a great thing to be. And you sort of learn a lot of sort of people-pleasing things along the way. And of course, socialized as a woman, we can throw that in there as well.
Yep.
Went straight from college to medical school and then into family medicine residency and did well, but was always kind of looking for, oh gosh, I wonder when things are going to feel better. And I remember my residency advisor would always be like, oh, second year is easier than first year. And third year is easier than second. And I was like, that doesn't seem to be true. I'm not sure why you keep telling me that over and over, because it seems like things are getting harder, more responsibilities, more people asking me to do things. But regardless, I, graduated and went into practice doing pretty broad scope of family medicine for the United States. So I was delivering babies, doing clinical practice, occasional hospital medicine as part of teaching residents, and started a family at that point as well, pretty early in my career. And again, just had this experience of constantly looking for, when am I going to feel better? When is it going to get easier? When have I done enough that people will sort of start to ease off on all the things they're asking me to do? Along the way, I picked up teaching in our family medicine residency, joined the faculty there, 2 kids by that point, and life just kept feeling harder and harder. And I didn't know why, and I thought it was me. I thought there was something wrong with me, that I don't feel happy. I feel like I'm constantly working harder and harder, and it never feels like enough.
Wow. I think we can all relate to that. I'll share my own reflections. I mean, it's, you sort of touched on this. This starts long before we even enter medical school. I mean, medical schools select for conscientiousness and a sense of duty and obligation, which is not a bad thing. I mean, that's how you want your doctors, but it is a perfect recipe for this perfectionism burnout cycle. And we're all surrounded by each other on top of it.
Right. And we're all hiding how we feel from each other.
We're all hiding how we feel.
Do that.
Right.
Absolutely.
But you just don't want to raise your hand and say, I'm not happy.
Right.
Or I don't feel like doing
this. This isn't enough for me.
This isn't enough for me.
Yeah.
So then talk about perfectionism.
Yeah.
Talk about how this impacts us in a very real sense.
Yeah.
I'd love to dig down on this and hear more.
Yeah. So you probably grew up with the same idea that perfectionism sounds great, right? It sounds like, oh, I'm just a perfectionist, right? It sounds like this very benign, hardworking sort of process. But a lot of the way that it's defined, especially by Brené Brown, who I follow closely, is that perfectionism is really shame avoidance. Right. So if I act perfect enough, if I know enough, if I, look right and sort of perform excellently, then no one can no one can shame me, right? No one can cast me out. No one, I'll have to be a part of the group and no one will see any flaws in me. And there is a huge difference between that perfectionism, right? That desire that I have to do everything just right, and excellence, right? Wanting to do a good job, wanting to learn more if you've got a knowledge gap, wanting to do the right thing. Those two things are not the same. But often, again, our medical training has really reinforced this notion that I need to avoid shame at all costs. I mean, that's literally, when we're on rounds, right? We're being pimped by our attendings, and they're trying to find out all the things we don't know. And we are humiliated.
Yeah, it's a shame-based learning system.
Right? So we're all steeped in that. Right? And it often for many of us just keeps going. But the stakes get harder, the responsibilities get more. We throw families and other, kind of outside responsibilities in there. And then we're trying to keep up on those planes too, right? Have that perfect Christmas card or whatever the
Yeah.
keeping up with the Joneses says. It's an unwinnable game and it's so toxic inside.
And, I'll share my own reflection. I mean, we talk about those external voices, right? Whether it's, family or friends that have expectations of us, our broader community of how we should behave or look, what colleagues say, superiors say. But the hardest voice is that voice inside
Yeah.
saying, I'm not good enough.
Yeah.
Or not worthy to be here or shouldn't be here.
Yeah. And often that person that you may see, and maybe working alongside who is someone who seems really harsh, really judgmental, really, kind of always unhappy with your performance, other people's performance rather. If we could listen inside of them, we would often find that negativity, that judgment, that shame is even more intensely turned towards themselves because we can't shame and blame others without having a high degree of it within ourselves.
Wow. Wow. So, how does this play out in terms of our day-to-day practice as
Mhm.
physicians who have now, settled into our careers? Talk
Mhm.
about how it impacts our scheduling, our patient interactions,
Yeah.
our, vacations. Talk
Yeah.
talk about how this, bleeds boundaries, if you will.
Yeah. Yeah. And I often talk about this, looking at perfectionism and people pleasing and lack of boundaries together, right? Because there's a lot of overlap between them. But, it shows up as us being unwilling and afraid to say no, unwilling and afraid to set boundaries on our schedule, or whether we can throw in an extra patient, or whether we'll set an agenda with the patient and say, I'm sorry, we don't have time to continue today. I know that you'd like to discuss these other things, but we're out of time for today, right? So much of the time too, we're operating in very broken healthcare systems which are strapped and under resourced. There can be things like, lack of beds, as we've discussed earlier, or, we don't have nursing staff or things like that. So everybody's responsibilities seem to have gone up, right? While our bandwidth has gone down. But if I'm internalizing that I'm not doing enough for my patients and I'm bearing the weight of all of the shortages and the brokenness of healthcare, right? Then that is a recipe for disaster because I will not take the time to take care of myself, make sure that I'm eating, sleeping, peeing, feeling connected with my family, having some fun, God forbid. Right?
Well,
And
let me
it
interrupt
never
there and
ends.
just say that this notion of shame in our careers and perfectionism bleeds into our
Yeah.
inability to be present during
Yes.
family and personal time because you feel this nagging inadequacy eating away at you in the back of your
Yeah.
mind that you should be doing more or that you could have done more. Maybe I should
Right.
have
Or maybe I
squeezed that.
didn't do that right. Or
Maybe I should have
um,
squeezed this other patient in.
absolutely. Absolutely. And we often interpret, if we're used to sort of people pleasing and lack of boundaries, we often interpret other people's disappointment as proof that we're wrong, or, proof that we can't do that. Right. If I'm uncomfortable with saying no to you and you get upset with me, right? If my default is just to roll over and do it anyway, right? Like, oh, okay, I guess so. I guess I'll do that. I guess I'll join that committee. I'll do these extra things for you today. Then I'm interpreting my own discomfort with their disappointment as proof that I shouldn't be trying to set boundaries, right? And that's where we often really hit a struggle, because we can talk about boundaries, but we need to talk about us not controlling other people's expectations as well.
Mm,
I don't,
that's theirs.
that's
You don't have
theirs.
to own that. You don't have to internalize that.
Yeah,
That's an ish them, not an
right,
issue.
right. I love that issue. Yeah, because, I don't control, how sick my patients are when they show up. I don't control that they've got a list of 17 items. What I am working in, though, is, a healthcare system that has, time constraints and constraints on what is available to me to solve that day, right? Similarly, sometimes in primary care or in the emergency room, right, we might get pushed to do things that, are really, at a specialist level. We want to help. We want to do more and provide the care that the patient needs, but that's not always the best solution. And the difficulty with finding specialists, if we continue to sort of suck it up and take on more than is reasonable for us to take on, then we're enabling the healthcare system to not make any changes, right? And as long as we do that, there's no pressure on the system to hire the appropriate amount of staff or get the appropriate amount of resources, because they'll just continue to push us. Well, you care about people, just take on an extra person.
Just do
Well,
a
we need
little
you to stay
more.
late. Just do more.
One year at our conference, we had an incredible speaker come who cares for physicians primarily in her practice as a
Mm-hmm.
psychiatrist. And
Mm-hmm.
she stood up and told the whole room, don't tell us to be more resilient.
Yes.
Don't give us another online module to do telling us
Or
to be more
yoga at
resilient.
lunch.
Yeah, yoga at lunch.
Or yoga before work.
Yeah, like goodness, it is not about doing more and adding more to our to-do list. It's actually about doing less and doing it happily. But yeah, don't tell the profession to be more resilient. We are already highly selected for this resiliency, and we are trained in it and we practice in it. It's what
Yeah.
is the limits of human capacity.
Yeah. We need
And
to learn
most
to turn it
physicians
off.
who are burnt out are working beyond what is a reasonable limit for human capacity.
Yes. 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 We need to learn how to turn it off, right? To say, yep, even though I see it's very busy here, and technically speaking, I could stay longer and do more, but it's ultimately better for me and every other person that I go home and rest, that I go home and take care of myself so that I show up again tomorrow.
Yeah.
Yeah. But that's
So,
not something that often comes to us from the outside. People don't sit us down. Our managers and clinic leadership and hospital,
nobody is going to sit you down
they
and
do
say, you
not
know
share
what?
that with
Don't
you.
worry. Things are rough right now, but it's important you get home. But we actually need to start having those conversations in the workplace, saying
Absolutely.
like, listen, I know it's really busy today, but none of us is going to fix this. Let's just go home and, we'll have to just hit it again tomorrow. Right.
Yep.
So then, okay. So talk to us about like some concrete steps to make this better. I mean, I love on your website, it says, I am a recovering perfectionist, right? And in recovery, always in recovery, right? Because I think
Always
we
in
always have
recovery.
those tendencies. I know for myself, I've made a lot of progress in this space, but I always feel this backslide to
Yeah.
take another sip of perfectionism. You know what I
Yeah.
mean?
Yeah.
And so talk to us about like what we can do in a concrete sense, because if I can be honest, I think a lot of this goes back to even early developmental stages in our childhood.
Absolutely.
Right? So how do you begin to rewire? What
Yeah.
does that look like, Megan?
Yeah. I mean, I think, one really important step, right, is really tuning into our emotions, right? We've been taught to ignore our emotions often the same way we've been taught to ignore our bladders, right? Or our stomachs. And this can be hard to do at first, right? Because if we're tuning into our emotions more, we'll often notice more negative emotions. Well, we'll notice that we're feeling frustrated or resentful or overwhelmed or angry. But if we can start to understand what the thoughts are that are creating that, and often that's really where we see that perfectionism or that people pleasing, because the thoughts that are connected to those things are, I can't believe someone is asking me to do one more thing, or don't they see how hard I'm working, or how on earth could I possibly do more, or I have to do this all right. You know, when we can start to really understand those negative emotions and those negative thoughts, we can start to unravel them and start to say, it doesn't actually serve me to think that I'm the one who has to do all of this, that I can't ask for help. It doesn't serve me to continue to use other people's disappointment as a reason why I can't set boundaries for myself.
Wow. That's a
Right.
wrong fuel.
Right. So really sort of tuning into understanding that dynamic. And it's hard work at first, right? Because the well-worn ruts that are, kind of that we're used to, right, are saying yes, doing more, not disappointing other people. And when we're doing this work, when we're tuning into who we are and what we need, we have to get out of those ruts, right? And that's uncomfortable. One of my group members was saying, yeah, not only is it uncomfortable to like bump ourselves out of those ruts, but we're exposed. It's cold, we're up at the elements. And I'm like, yeah, that's a perfect way to think about it, because it's different, right? Change is something that we have to put more energy into, right, than following the well-worn ruts. But we also have to tune into ourselves and realize that I don't actually control other people's experience, right? I don't control whether my patients are happy. I don't control what their expectations are. But if I want to take care of myself and continue to serve patients in this model, in this place that I work, or however I take care of patients, then I'm going to have to set some limits on what I do for me. Because ultimately, taking care of me is my job. No one's going to do that for me. And I think for such a long time, I wrestled with wanting and expecting that the healthcare system would somehow take care of me, right? That they would somehow, tap me on the shoulder and say, hey, you need a break. Like, here's a week's vacation, or they would lighten my load and somehow, right? Or pay me more or something.
Or
But that
even
never
just
happened.
the reward and joy of practice.
Right, right, right.
It doesn't
It's not
that's
enough.
that's not the that's not that shouldn't be the fuel, and it certainly isn't the antidote to burnout and perfectionism.
No.
Right? You have to be able to go in and love your job even when it's hard, right?
Yeah.
And
Yeah.
even when you struggle, or you have complex patients or whatever it is, you have to be able to love your job, right? And but
Yeah.
that can't be the crux of, oh, I'm really exhausted. I worked at 70 hours this week, but I had some great cases.
Yeah. Yeah.
That's not sustainable. That's
Yeah.
not healthy. That's not the right reference point or goalpost that we should be using.
Yeah. Well, and so much of, kind of what we think of, in healthcare, so much of it seems tied to the physician, right? Patients do this, hospitals do, like, so much of a patient's outcome seems to be tied to the quality of the physician care, right? That's what metrics are driven by. And we believe it too, right? So we are often carrying around this burden. I've got all these sick people. It's my job to make them better. Meanwhile, we're ignoring the fact that most of a person's health outcomes are related to their socioeconomic status, their genetics, how they've been living their life for the last 70 years, whether they got a vaccine, and all of these other components that have much more of an impact than me taking care of them right now, right? And trying to reverse things that are going on that are already pretty deep in the process. But again, when we go back to our training, right? Treatment failures, right? Bad outcomes are so often blamed on us, right? I must not have the knowledge, skills, or experience to have, properly taken care of this, ignoring the fact that this patient came in septic with chronic kidney disease, poorly controlled type 2 diabetes, right? A really sick body. And I'm meeting it very late in the process. My ability to actually make impact is quite small, right? Something like 20% of our healthcare outcomes is related to the care provided by the physician and the healthcare team. The majority of it, generally speaking, is so many other factors that are outside of us.
Much of the story is told before we ever arrive in the plot.
Right. But if I'm carrying around this idea that most of the responsibility is mine, yeah, there's this little lifestyle and, yeah, they inherited bad genetics, but most of the burden is mine, right? I'm going to keep in that perfectionism model, right? Because I'm going to feel like I'm never going to be able to do enough for that patient.
Mm-hmm.
We have to let go of that responsibility. Not to say that we're going to provide poor care, but let's be realistic about what is possible and what's not.
Mm-hmm. Even just accepting that complications, misses inevitably happen.
They do.
I mean, you're
No
setting
matter
yourself
what we
up for
do.
failure. If you become a surgeon and you say, I'm never going to have surgical complications, well, that's just completely unrealistic.
Yeah.
And yet, when those complications occur, we feel horrible about ourselves.
Yeah.
Oh, I could have done this differently or that differently, or I missed this or I missed that. And we can tear ourselves to pieces,
Yeah.
but without accepting the fact that every surgeon has complications.
Right. And every body is a little different.
And everybody's a little different.
We learn where most of the organs are supposed to be, right? And how they're supposed to operate, but they don't always follow those instructions.
Right. So it's this notion of struggle is inevitable in a career like this.
Yeah.
Right. I mean, you're a professional athlete and you're going to have bad games.
Yeah.
Right. And so it's okay. Well, how do I overcome that?
Yeah.
Right. And how do I keep going and not just limp along?
Right.
But truly thrive. Say,
right.
Okay, something happened. I've learned, I'm wiser. I put it into context and I'm going to continue to confidently move forward in my career. That takes a lot of work, but it can be done and it should be done. Because like we discussed on your podcast, Megan, is if not now, when? If I'm not happy and thriving in my day-to-day clinical practice now, when am I going to?
Yeah.
Because it isn't going to be sometime in the future, like you said.
Right. We won't get to retirement and magically be a different person, right? We won't have the capacity, honestly, to feel joy and gratitude because if we haven't been practicing it, we won't spontaneously experience it.
And it's a skill. You have to work at it, but it does get better.
Yeah.
So I don't want to keep going on and on and on, although I could. Trust me.
I could
maybe
too.
we should just get you back on the show and dive deeper into these topics. But talk to me about like how coaching in this space can be so helpful for physicians.
Yeah. I think a lot of the work that I end up doing with physicians is really about dialing down, yes, that messaging, right? That I have to do everything perfectly. I have to say yes to everybody. I have to hold all of this. Because so often the messaging and the pressure on that physician is that they should just say yes with a smile. They should, see more patients, make it to all the meetings. They should bring cookies. That's often, for us socialized as women, right? Like we should contribute to the potluck and be just fine with, being called that lady doctor or being mistaken for the nurse, right?
I've got daughters myself, and it boils me over, and I'm working so darn hard to raise them without that, socializing, as you call it, because it's horrifying.
Yeah.
Anyhow,
and
sorry.
It's quite pervasive, and it's, we'd like to think, oh, we should be done with that, in medicine, but no, of course it's still just like racism persists, right? Like we're working on it, but we're not done with any of that. But really sort of trying to figure out like what is that internal dialogue that is going on for that physician about what they owe to others, what's getting in the way of them taking care of themselves, where are they struggling. A lot of times people come to me and they're really struggling with charting, or they're thinking they want to leave that job. We really sort of use that as a jumping off point to really untangle this internal dialogue and figure out, okay, but you're not broken and you do have agency and choice, and you can start to say no. And here's how we, start working on this. And through that process, really learn to be with our emotions, to see that connection between our thoughts and our emotions, and see that we are not responsible for fixing the broken healthcare system. But if we're going to continue to work in it, or if we're going to choose to leave, right, we need to learn how to take care of ourselves.
Mm-hmm.
Because so many of my clients, have been working, 80-hour weeks and always putting others first. And they don't know how to do self-care, and they don't know how to answer the question, what is it that I want? Like, that question just stops them.
Yeah. A lot of us don't actually
We have no
know
idea.
what we want. We maybe have a sense of what we
I
don't
wanted
want.
to be a doctor. Okay, well, I am, but now what?
Right.
What else?
Yeah.
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 Yeah. So
So
it
powerful.
really does a lot to kind of offload the mind, right? The mind that is telling them you're the only one who's like this. You should be happy just with the joy of taking care of patients and serving others. And the guilt and the resentment and frustration that are kind of all tied into that. So really sort of understanding that internal dialogue and where that came from, and how do we start to undo it, so that no matter what you decide to do, you will feel better. You will have better boundaries. You will see that you are not responsible for fixing the broken healthcare system, and you're not responsible for other people's emotions.
I love that. Love
Yeah.
that.
Yeah.
So how do we reach you, Megan?
Yeah.
For anyone that's listening.
Yeah. So I've got a podcast called Ending Physician Overwhelm, and that's available on all the major podcast players. And then you can also find me at my website, which is www.healthierforgood.com. And I have a blog there. You can link to my podcast from there, and you can find out about working with me either one-on-one or in my group coaching program.
Wonderful.
Yeah.
I love it. Thank you again so much for your time today and your insights, because I think this is the unspoken
It's what we needed to learn.
issue that we have pervasive within the medical culture, right? And even when you just talked about like how others may be externalizing their internal shame, was just eye-opening for me. So again, I really want to thank you for highlighting such a big issue. And it's difficult to, I think I'll just share my own reflections before we wrap up, but it's difficult to, accept on at the outset. You could say, well, this has been since my childhood. This is the way the profession is. But the truth is, it's highly empowering, because it's a matter of turning the cameras inward and doing the self work.
Yeah.
And we are highly resilient. We are highly intelligent, and we're hard workers. So if we direct those energies towards the self-improvement, it can get better. And it's independent of what hospital you work in, who your colleagues are, what happened to you years ago in your life. The truth is, you can make it better now with that self-work. So I think that's so powerful. And again, it was wonderful having you on the podcast, Megan.
Yeah. Thank you so much for having me. It's been a real pleasure.
Thank you for all your work supporting the profession.
And for you.
Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at phys-empowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@phys-empowerment.ca. Thank you again for listening.